Good evening. Thanks for being here. I'm Troy Charles. Here are your top stories. The Thunder Bay District Health Unit reported 26 new COVID-19 cases today, along with the district's 53rd death linked to the virus. Saturday's total included cases from Friday, when the health unit did not report new infections. Active cases in the district have hit their lowest level in over 6 weeks, falling to 183 thanks to 52 previous cases now considered resolved. All but one of the cases reported today involved Thunder Bay area residents, while one was in a district First Nation. 15 were attributed to household contact, 6 to other close contact, 3 had no known exposures. Exposure category for 2 others was pending, and hospitalizations also fell by 6 since the health unit's last report on Thursday. There were 12 district residents in hospital with the virus as of Saturday, with 3 of those in the ICU. With the COVID situation somewhat stabilizing in Thunder Bay, the same cannot be said for much of Canada. Hospitals across the country are struggling to care for the increasing amount of ICU patients as variants of concern continue to run amok. CTV's Annie Bergeron-Oliver has the details.
Across Canada, frustration is mounting as exhausted healthcare workers struggle to care for the sickest COVID-19 patients in a third wave where case counts just keep rising.
It's awfully demoralizing. It is, we've run out of adjectives for describing how sobering, how traumatic, how absolutely tragic this situation is.
For the second day in a row, Ontario reported more than 3,000 new infections. And despite new restrictions closing personal care services, fitness studios, and indoor and outdoor dining, doctors fear it's not enough.
The GTA is on fire with COVID-19, as are the hospitals that serve them. And unless something changes now, this situation will get so far out of control that I don't even want to consider what we might have to do if things don't change.
Doctors in Alberta are calling for change too. With more than a third of all cases now variants, many are pleading with Premier Jason Kenney to take a page out of Ontario's playbook and implement a month-long circuit breaker.
As we continue to see cases rise and the number of active people in the community with virus, the options become more and more narrow, such that only things such as a circuit breaker will have an effect.
An effect those on the front lines are desperate to see take hold as hospitalized patients get younger and the dedicated staff grow weary.
COVID is a virus that we do know how to control, and we can delay and prevent cases, and we can prevent death. So it's absolutely exhausting, and I'm really worried.
One significant change advocates say provinces could make now is to implement paid sick leave and to prioritize vaccinations for essential workers, including those in factories. Annie Bergeron-Oliver, CTV News, Ottawa.
Police have charged 50-year-old Stanford Kokakons of White Sand First Nation with second-degree murder in connection with an assault east of Armstrong. Officers with the OPP's Armstrong detachment were called Thursday to a residence in the community of Mud River, located about 35 kilometers east of Armstrong. Police responded to the call along with paramedics with Superior North EMS. The 27-year-old victim, also of White Sand First Nation, was pronounced dead at the scene. Kokakons now stands charged with second-degree murder and has been remanded into custody. Thunder Bay Atikokan MPP Judith Monteith-Farrell spoke at Queen's Park this past week, addressing the need for childcare for essential workers and vaccine supply. Monteith-Farrell said residents have difficulty booking appointments, and she believes that Southern Ontario has far broader access.
People in my riding are begging for vaccines. What are we going to do? What is the government's plan? What is the clear and transparent plan to get vaccines in the correct numbers to Thunder Bay, and when is this going to happen?
And the vaccines are being allocated equitably across the public health unit regions, all 34 of them, based on population and based on risk factors. We are very fortunate now that we've received a significant supply of the AstraZeneca vaccines, which will allow us to open up more widely across the province. 3 pharmacies, at least in each public health unit, will be carrying them, as well as primary care providers.
The construction of a crematorium at a Dryden area funeral home is once again up for discussion. 2 years ago, the idea was met with opposition from residents and the project was pulled. Now the project is being discussed once again with some support, but the opposition still remains. Adam Riley reports.
It's been 2 years since a request by the Dryden Community Funeral Home for a zoning bylaw amendment was cancelled, and a few months since it was reintroduced to council. The request would allow the funeral home to expand its operations and allow it to construct a crematorium on the premises. However, opposition to the project from those living in a nearby neighborhood remains as strong as it was in 2019.
The change in the bylaw would not only be detrimental for health, but it would not be good economically for North Dryden or the city as a whole.
I'm disappointed, tired, and overwhelmed that we as North Dryden residents have to go through this process once again.
In addition to those presenting via Zoom, city staff spent 30 minutes reading letters submitted by residents both for and against the facility. Issues mentioned by opponents included noise, proximity to walking trails and a nearby waterway, and emissions. Spokesperson for the proponents, Phil Savage, says $80,000 has been spent so far on reports and applications for this project.
These have placed an immense financial burden on the funeral home, and we refuse to be relocated to another location and incur more costs due to public misinformation and misguidance by individual uneducated opinions. Misinformation, lack of proper research, and the ignorance of actual facts are the root of this proposal's opposition.
In questioning of the opponents, Councillor Norm Bush hinted at the misinformation and acceptance of facts, but Bell says there isn't enough data.
That the emission levels were at low enough levels to not be deleterious to human health and safety. The government scientists and the official regulators. Would you support the science, or would you not trust the government?
Not only can we not prove that it isn't safe, you can't prove it is safe. There's the problem. The data is not there. The parameters right now could change.
On the opposite end of the spectrum, the crematorium proposal has support from some residents, other regional funeral homes who would benefit from it, and agencies like the Bereavement Authority of Ontario.
It's now about 90% cremation in some parts of Ontario. Obviously, there's some holdouts like the certain parts of Toronto area. They're more towards full-size funerals, but everybody else is going 80-90% cremation. There is definitely a need for a crematorium in the north.
Council is expected to make a final decision on the amendment at its April 26th meeting. Adam Riley, TBT News.
It was a wet one down on Water Street this afternoon after a water main break closed a section of the street. The street was closed to southbound traffic for a short stretch between Cumberland and Bay Streets, creating some backups on nearby residential roads. Thunder Bay police were on scene to divert traffic. A City of Thunder Bay worker at the scene said the break began around noon, and he could not yet estimate when the issue would be resolved. Superior Collegiate has been nominating a few students each quadmester for academic accomplishment, outstanding effort, and excellent work ethic. And school staff recently celebrated the nominated students by delivering special recognition packages to their homes. Grade 11 welding student Johnny Fairs was one of the recognized students this past quadmester. Fairs has led by example in his classes, being engaged and helping others when needed. His recognition package consists of a note of encouragement and a package of Yum Yum hot cocoa bombs. Fairs admits it's not always easy doing online schooling, but he always gives his best effort.
I try to hop in there when I can. I try to add comments, help out when, if they're sharing screen and they just say, oh, hey, can you see my screen okay? Just saying yes, just trying to be as helpful as I can.
It's just encouraging, I think, for him to realize, like, okay, I don't feel like I'm always doing the best I can, but, people are noticing that I've tried, so that's good for him.
We know that these students are at home doing the best that they can, and engaging with us online as best they can, and it's rewarding to be able to celebrate student success.
The Lakehead Board also understands how difficult online schooling has been for both students and their families. The board offers supports for mental health, emotional help, wellness, student support, professionals, and social work supports on their website. A popular local farm found a new way to celebrate Easter safely this year. Like many pandemic-run events, a drive-through version of Gammondale Farm's Easter egg hunt went down this afternoon. Catalina Gillies has the story.
Gammondale Farm is known for their annual Easter festival and Easter egg hunt. Last year's celebration was canceled due to the pandemic, but they weren't going to let it stop them this year. The farm hosted a safe, contactless event today for families, featuring Easter baskets, animals, and a photo opportunity with the Easter Bunny.
I'm very excited.
Super excited. Are you excited?
Yeah. I know about horses. Horses can't catch COVID.
Cars were able to stop for a few minutes for pictures and collect a basket filled with chocolates and prizes. Director of Gammondale Farm, Sue Gammond, talks about the changes to their festival this year.
Today we're doing a drive-through Easter event to pick up an Easter basket that's meant to be full of all the things you need to put on your own Easter egg hunt. So that was the idea of it, because we can't do our Easter egg hunt the way we normally would. And it's contactless, but we're having lots of fun. It's a beautiful day.
Not only was this Easter celebration a fun event for families, Gammon says a portion of the proceeds will be donated to the George Jeffrey Children's Center. Catalina Gillies, TBC News.
Catalina getting a little close to that horse. Got to watch out for the old back kick.
Hey, well, that kid told us horses can't catch COVID, so we're okay.
Avery, I love watching Bianca Andreescu play tennis. Was it lovable today?
She was lovable for a time, but then things got a little shaky. We'll tell you what happened when we come back.